Hello everyone, welcome to the first ever podcast of Dr. Vaidya's Laboratory. Today we are going to talk about one of the most important topics on sexual education, especially during the wedding or pre-wedding season. In today's day and age, we actually look at a lot of couples who go through a lot of premarital or postmarital problems in terms of the sexual health and wellness. When it comes to the topics and myths of erectile dysfunction, or when there are problems about conceiving post-marriage and during childbirth, the kind of problems that the couples face are something that we are going to kind of discuss about it with our guest and one of the esteemed sexologists of the country, Dr. Ajit Pradhan. Welcome, sir, to the first ever podcast.
Thank you so much. Thank you.
We are very glad to have you on this, and we would like to discuss about the kind of problems that the couples face in today's day and age when it comes to the sexual health and wellness post-marriage and even pre-marriage. Some of the myths with concerns to erectile dysfunction and the conceiving post-marriage in women is what we would love to have your point of view and your knowledge on this subject for our viewers and consumers. We would also like to discuss about what all tests the couple should actually go for in terms of the diagnostic testing pre-marriage, because that would actually help them to kind of have a certain lifestyle changes and certain medications to actually overcome these problems. So with this introduction, I would like to welcome Dr. Ajit Pradhan.
Thank you.
So my first ever question, and for the audience also, if you would just give us a brief introduction about yourself, that would be excellent.
Many thanks for having me here in the Dr. Vaidya's Lab podcast. This is Dr. Ajit Pradhan from Thane. I have my own clinic in Thane, the Thane Sexology Clinic. And I've been practicing in this field for the last 45 years. And I've been giving lectures on this particular subject in many Rotary clubs of Thane also, in Mumbai also. My subject is age is just a number and life is just a pleasure. So I've given a number of PowerPoint presentation in various clubs and cities of Mumbai and Thane also. So today we are going to talk mainly the problem that the men faces in the field of sexology. People come to us normally for two reasons. One is erectile dysfunction and second is the premature ejaculation. So we will take first the erectile dysfunction problem.
Sure, sir.
Thank you.
So when we talk about the topic of erectile dysfunction, what exactly is erectile dysfunction?
So erectile dysfunction definition is persistent inability of a male person of not getting the proper erection and not maintaining enough till the penetration happens. It's a simple definition of erectile dysfunction. And erectile dysfunction is not a disease. It is a symptom of underlying problem.
Okay, so you mean to say that erectile dysfunction is common between all the age group of men, be it in the early 20s or teenagers or even in the older part of the human population?
So erectile dysfunction is very common in various age groups. It all depends upon the age related also and performance related also.
Okay. So how does it happen actually? What are the problems which actually men face in the early stages of the life of when they are going through erectile dysfunction? And how is it that they can recognize the symptoms of erectile dysfunction so that they can meet with the doctors? Because these days, as we know that talking on the topics of erectile dysfunction, sexual health and wellness, it's actually considered taboo even in today's day and age. Be it in the younger population, they are afraid of getting bullied by it. Some of them, they are ashamed to actually talk about it to their parents, because parents being into our society, look at it from a very negative aspect.
Right.
And also from the point of view of what your friends or colleagues might say, or your respective partners or your girlfriend might say, would be a kind of a shameful act which is there in every man's or young boy's mind. So how can they overcome it, and how can they deduce or detect the symptoms in the early stages itself?
See, as you rightly said, erectile dysfunction is not a disease, but it is a symptom. Now, this subject, the sexology subject, or when it is not talked in our society, but it is whispered in our society. It is never talked openly. Even though our country is developing and it is a developed country now, but still the taboo is there. people, many corporates and ministers, they say that sexual education is very necessary so that we can avoid rape and problems, suicidal tendencies and all that. But if the person is well educated before getting married, he can have a well knowledge about what is the sex. So it is hardly given to anybody, and they get the education for unidentified person, and that can affect their performance also and the sexual relations also, and may land themselves in a very awkward position or suicidal tendencies also.
Okay. So basically, the detection of ED in the early stages might help in overcoming their male egos or the depression or the anxiety which a young boy or a young man goes through in their life. Can we talk about the basic aspect of how the erection happens?
Yeah. See, erection happens because of the penile arteries. They flow the blood from the body to the penis, and with the flow of that blood in the penis, they get the erection. This is a normal procedure. But in erectile dysfunction, the blood flow that is happening from the penile arteries to the penis cavernosal muscles is not adequate. They are affected due to the atherosclerotic changes in the body that can lead to the erectile dysfunction. And it can be diagnosed by color Doppler studies of penile arteries in the laboratory. So that suggests whether the obstruction is there is damage inside the lumen of the arteries. There we can find out.
And when is it that the erection happens? Like, is it common when a certain young boy is in its growing or puberty stage, they go through premature ejaculation? Now, is it a bad thing to have a premature ejaculation? How does it happen, or how does erection happen?
See, erection happens due to the blood flow that is going inside the penis, cavernosa muscles of the penis. And whenever the person is in the foreplay, or he is doing masturbation, or he is watching the porn, or he has a sexy thoughts in her body, or he is getting the stimulus from his partner, he can get the erection, proper erection. Now, erection happens from the adolescent stage, about 14, 13, 15, depends on the health of that particular person. And so, this is a normal phenomena that everyone should get the erection. Now, whenever person sleeps in the night, he automatically gets 5 to 6 times the erection, and he does get the morning erection when he wakes up in the morning, and that is a normal phenomena. If somebody is not getting those morning erection for certain reasons, and it cannot be daily, it can be occasionally, say once in a week, twice a week, thrice a week, when he sleeps with a sexy thought and all that, he watches the porn and sleeps and all that, he is bound to get the morning erection.
Okay.
Yeah. But as the age advances, say 50s, 60s, 70s, the person has diabetes, blood pressure, thyroid problem, all those, then the erection might not happen in that particular age. Yeah. That is
Now, since we talked about when does the erection happen or how it happens, can you give us some information on what are types of erectile dysfunctions?
Very good question. See, there are many types of erectile function, but two most important erectile dysfunction causes is situational erectile dysfunction. That is what is happening there, ki one can perform at certain place but not able to perform at some other place due to various reasons. And second, which is most common, is the vascular erectile dysfunction. When the blood flow in the penile arteries are affected, or due to damage of the arteries or blockage in the arteries, so the blood flow which is required 90 plus in the arteries is only 50%, 60%, and that can affect the erectile dysfunction, and that can be tested or investigated in the laboratories by doing color Doppler studies.
Okay.
Yeah.
So, is it like erectile dysfunction is a disease? Is it a psychological disease or a physiological?
Erectile dysfunction is not a disease, first of all. It is a symptom of underlying problem.
Okay.
Symptom. So patient or any person can get anxiety, performance anxiety, not able to do the relationship properly. All that can affect the erectile dysfunction.
So, like I've seen in a lot of youths or in a lot of forums that people go through ED because of the thought process that they're not able to perform properly. And main reason these days that I'm looking at it is because of the penis size. that is there. I mean, the people, due to a lot of phones and internet activity that go around, in both male and female, there is a thought process that size of the penis is directly correlated to the amount of sexual satisfaction that they get. Is it true?
That is the biggest myth in our society. The size of the penis and the relationship are correlated. That is not true. It is not the size. It is the girth of the penis which is more important than the size of the penis. Because in the penis, only 1/3 portion, which is called glans, is the maximum sensation are there. But the shaft of the penis has no sensation. Like that in the female vagina also, only 1/3 portion has a sensation, 2/3 portion has no sensation.
Okay.
Like our tongue, whenever you eat something or put some sweet thing on your tongue, you get the taste. But the same thing, if you put posterior 2/3 of the tongue, you will not have a taste of that particular
Correct.
material that you are taking inside. Similarly, so the size of the penis has nothing to do. It is a technique. It is your technique, how you go in the foreplay, which is how you excited your partner, which is more important than the length of the penis.
Okay. That's actually a very good input from
Yeah.
your side, because these days the kind of myth and
And I'll tell you one thing, those who look at the porn and all that, and they see the size of the particular, that giants, they see that हमारा तो बहुत छोटा है. So it is not that. It is the technique, how you do the foreplay. That is more important than, because 75-80% of the pleasure in the sex is in the foreplay only. This is the production machine. So the pleasure comes for male and female. Pleasure is there in the foreplay only. This is just insertion and ejaculation, like a ink dropper. You take the ink from the bottle, put it here. That is only work of the penis. Sex is from top to bottom.
that's very interesting actually
Yeah.
topic. Now, one more thought that I have in my mind is that these days, how a person can recognize the signs or the early symptoms of erectile dysfunction.
See, the signs, the person has a desire, but he is not able to perform. This is the first sign. Person does the masturbation and get the erection, but when he is with a partner, wife or any girlfriend or something, he is not able to get the erection which is there in the masturbation.
Correct.
Third, performance anxiety. He is so tense, he is so, because sometimes the wives or girlfriend, they test the person whether he can perform, and accordingly they will decide what to do, whether to marry, whether to keep the relation further, all that. So it is the problem that woman or any lady for that matter can give to the male partner.
How to overcome this? Like if suppose tomorrow someone is kind of going on with their lifelong crush on a date, and if they decide to actually get intimate on this subject, then in that case the anxiety will always be there for a male, and they would feel that, okay, what about if I'm not able to perform?
Correct,
Then
correct.
how can they overcome such situations?
First of all, you should see the root cause of erectile dysfunction. You must relieve yourself from stress, tension, anxiety. Whenever you go for the sexual relationship with your wife or girlfriend or whoever it is, you must not look back. Okay, last time I had gone and I could not perform, so today I'm going, will I get the erection? Will I able to penetrate? Will I able to satisfy the partner? If those thoughts come to your mind, you are not able to perform. So leave those thoughts behind and go as a fresh and perform. Because your compatibility with the partner, your dialogue with the partner, your communication is very, very important. There is a saying, slow and steady wins the race. So you must go slowly and gradually and do good foreplay. Normally, Indian average foreplay is 15 minutes flat, but you can go for half an hour, 45 minutes, 1 hour also. The more foreplay, it is more erection. It is directly proportionately related to the stimulus that you get from your partner. Erection is going to happen.
But then there are certain cases which I've seen basically in a lot of people actually, when I interact with them on certain topics, some of them, they have actually told me saying that, I mean, they're able to perform when they are normal, but then when they are under the influence of alcohol, they are not able to. And on the other hand, there have been people who have told me that under the influence of alcohol, they are able to perform better.
That is that is very wrong thought that anybody can have, because alcohol may be addiction. Alcohol should be taken for enjoyment. See, alcohol will increase your desire, but it will take out your performance.
Okay.
If you are taking alcohol for just enjoyment, one peg, suppose somebody is sitting with somebody and they are taking alcohol. If you take one peg of alcohol, I am going to two pegs. You take two pegs, I take three pegs. That is a problem.
The male ego competition.
Male ego problem. And there person becomes, the desire goes high. But actually when it goes, erection goes down. So that is the most myth in the society. The alcohol, you will become a tiger, but performance bagri jaisa ho jayega.
So coming back to our original topic, if when suppose a couple is deciding to get married, what are the most important test or symptom that they should actually keep an eye out for, and what are tests that a male should go and do from a pathology lab, a pathology kind of test,
Correct.
made from the pathology point of view or even from the psychology point of view?
See, most of the clients, when they come to us for a pre-marriage or post-marriage, we say that instead of going to the astrologer, better go to the lab and test yourself, which are vital investigations that may require to you if you don't conceive or your relation gets spoiled due to some reason. So most important investigation nowadays is HIV test, lipid profile, LFT, liver, fatty liver, cirrhosis liver, then hormone levels, semen analysis, and routine blood sugar, thyroid test, and vitamins like vitamin D, vitamin C, vitamin, all those tests are required, because it is found when you are tested only. You cannot look at the person and say, yes, semen analysis mein to ye kam hai. No. Unless and until you test in a very good lab, authorized lab. There are n number of labs, like a pan ka patti ka dukan rehta hai na, so every nook and corner you will see the lab, but they are not authorized to give the certified investigated reports unless and ISO and all that labs are there, NBL, NABL. Those are the lab where you have to test, and it's a vital test, because if the test suggests something, we treatment according to the test.
Okay.
So this is very vital that you must test yourself before going for the marriage.
Okay.
And both of them are tested. Her hormone level is also important. Her vaginal problem may be there if she is not getting proper menses at particular month and all that. This is also very important. So all the tests are very, very important doing pre-marriage.
Okay.
And post-marriage tests are, see, normal the definition of this thing is that 2 years of married life, having regular sexual intercourse, not using any contraceptive, but still she is not conceiving, then she has to be tested. And the male partner also tested. She has to test her hormone levels, her vaginal examination, her thyroid problem, her obesity problem, if she is having PCODs. All those should be tested. And if the problems are early, you have to take the chance as early conception should happen. Because you are late, then the problem will aggravate.
True. So, in this scenario, is there a particular time period after marriage that that a female should be able to conceive? Like, if they are doing for family planning, then in that case, how much standard amount of time for conceiving? Post which there can be a thought that both of them might, or either of them might have some or the other kind of problem.
See, normal age of India is married life is start from 25 years. So 25 to 35 is the ideal age to conceive. Okay. Once a female crosses the age of 35, her ovarian results become less and less. She may land up in PCOD, she may land up in diabetes, all the dryness of vagina. If the age increases, dryness of vagina is there, and then the insertion of the penis inside the vagina will be painful and not a pleasure. Okay. So all these are very important. The age group 25 to 35, one should conceive. Then after the age of 35, if somebody conceives, then there will be abnormalities of the child. Actually, once the female crosses the age of 35, 34 and all that, first of all, she should test herself for hormone levels. Then she has to test for thyroid. She has to test for PCOD problems like All the tests which are the vaginal examination, it should be done by a gynecologist. And those tests, if it done and if it is normal, she can conceive. But if there is something abnormality like hormone levels are low and all that, then we can treat by some medicines and all that. Or PCOD is there, she is putting on weight, hirsutism is there. This all comes in PCOD.
Yeah.
So she should do a regular exercise, diet control, and all that is very. And then they should conceive as early as possible. If they become late and late, the finance problem is there, our career problems are there, then the late goes very late.
Okay. So you talked about a lot on PCOD. Can you enlighten us about what exactly is PCOD?
See, PCOD is where the ovaries, there are two ovaries on each side of the uterus.
Yes.
And in PCOD, the eggs becomes less and less functional, and their quality, quantity, motility is not, but morphology becomes less and less. They put on the weight, hair problem are there, hair comes on the pimples come, abnormal periods will come, the long period, 40 days, 45 days. All that indicates that she must be having PCOD. But unless and until you test in the hormone levels also fluctuate there, perspiration is there, sweating is there, all those can indicate the PCOD problem, and then you have to treat accordingly and try to ask that particular lady to conceive as early as possible. That is a fact.
Okay. So at Dr. Vaidya's laboratory, we have come up with certain kind of sexual wellness packages for both male and women. So some of the packages, some of the tests that includes in the packages are your CBC is there, blood sugar testing, fasting and post. We have FSH, LH prolactin test, VDRL serum,
Correct.
Testosterone protein, your hepatitis A, B, C, TSH, progesterone, AMH, and your HIV.
Correct.
So, are there any other tests that a couple or as a pathology lab we would like to, that you think that we should add into our packages?
As you said, some profiles like lipid profile, thyroid profile, LFT, these are very important, and blood groups also should be added because if she is negative and he is positive, then you have to take precaution. And most of the tests are covered in these packages.
What are orgasms in scientific terms or in the layman terms? If you can explain to the audience about what exactly are orgasms.
Orgasm is reaching the Everest of the Himalaya. So, but it is directly proportionate to the stimulus that you get from the partner. Orgasm is ultimate pleasure. So when you get orgasm, as I said, you get a tip of the penis, the secretion is there, lubrication is there, that is in penis, tip of the penis, and the female is in the vagina, lubrication. That is a signal that she has reached the orgasm. Her breast swells, her nipple swells, redness happens on the face, she gets the inner voice also. All that indicates that she is excited to the certain level, which is the normal level or excited level.
One of the most important subject right now is about orgasms.
Right.
And there is a kind of a myth that female orgasms, they last for much longer time, and it's directly related to the size of the penis and how a male performs during the sexual interaction. Now, how true is it that a female orgasm lasts quite longer, and it's said that it might even go about, female can have about 100 of orgasms at one given point. Is it true? I mean, what exactly happens over there?
See, orgasm is like reaching the Everest of the Himalaya. You reach that level and orgasm comes. See, orgasm comes many times in the female, but the male gets one orgasm and he ejaculates.
Okay.
And female, as you said, female gets more time to get the orgasm. But she needs to stimulate certain spots which are called sexy spots or arousal spots. or erogenous spots. So there are different, see every person, male or the female, has some sexy spots, arousal spots in their body. So the male partner should know what female likes and female partner should know what male likes on his body. And if you happen to stimulate those particular spots, which are called sexy spots, there is no reason that you will not come from this level to that level.
Okay.
See, in male, the glans penis is the most sexy or the sensitive part in the male, and in female, clitoris is the most sensitive part in the female vagina because it has a rich nerve supply, and the clitoris represents the penis of the male. So if you happen to stimulate those particular spots or any other spot, see entire body, as I said earlier, is sex is from top to bottom.
Yeah.
So you must communicate with each other. You must be open. Ki, I like this, you like this. So you have to do accordingly. When a male gets excited, he gets a liquid secretion at the tip of the penis that is called precum. Like that, when the female gets excited or when she reaches the orgasm, she gets the lubrication inside the vagina, and that is the indication to penetrate and ejaculate.
Okay.
If there is a dryness in the vagina when she is not excited, many times happens. She is not excited, so there will be dryness in the vagina, and then when you insert, it will be painful and not a pleasure. So you must understand, you must see and open up with each other. What are the sexy spots, other spots? If you happen, there is no reason you will not come from this level to that level as far as orgasm is concerned.
Okay.
And there is something like G spot also. So if you stimulate, and it is very close to the clitoris, G spot. So it is almost same, but at the most sexy spots, and orgasm come with that stimulation.
So G-spot is not inside like it's shown on the internet.
It is just above the clitoris, but it is difficult to locate it. Right? It is not. It is very difficult for a person to locate. He is in performance anxiety. Where is going to locate the spot?
True. So coming back to the point, so we encounter a lot of times on the internet that there are certain medications or lubricants that are available in the market which are not prescribed, which kind of guarantees that you will have greater orgasm or fast orgasm if you use that, both for male as well as for female. The products for females are much more in those terms. So what do you think is advisable? Like, should people use it? They shouldn't use it? I mean, what is the scenario over there?
Actually, the sex should be natural. When dogs and all can do a sex on the streets, why not male and female can do it at their own bedrooms? But if problem is there, erectile dysfunction is there, and then it is found by doing investigation, then we prescribe the medicines that can increase the blood flow to the penile arteries and one can get a good erection. But again, with some problem like hypertension, diabetes, bypass surgeries, and all that, we avoid giving the dosage. Now, the first came in the market long back, some 25-30 years, was sildenafil, which is Viagra, which is very common.
Yeah.
But it had very side effects were very rampant in those particular medicine. But as the science improves or increases, there are a number of products in the market like tadalafil, avanafil, and all that are there. But now in our market, we normally prescribe tadalafil, which has less side effect as compared to the sildenafil, and it gives good result. But again, it should be for short time. It cannot be lifelong that you take. Your car has stopped. You have to give the push by giving the tablet, and giving the push, it starts and then there is no need of. But the partner, female partner or male partner, plays a very important role to give the satisfactory sex. If it is not happening, then the medication comes in the life.
Oh. So is it advisable to take Viagra? I mean, if anyone wants to experiment on that, or if anyone is, for momentarily, if they are going through performance anxiety and they are not able to get up or perform, then in that case, is it advisable? Because I think Viagra is available on the counter in each and every medical store.
It is rampantly available everywhere, but it has three strengths, 25, 50 and 100. So according to the health of the patient, if it is a hypertension, diabetes or bypass surgeries or thyroid problem, all that, then we have to adjust the dose. And it has many side effects like headache, stuffy nose, redness of eyes, back pain, all those side effects are there. Because every medicine has a side effect. It cannot see, but unless and until you take the medicine, then only you know the side effect.
True.
So we start with a small doses and gradually we increase. And now the tadalafil that has come in the market, which is more safer than sildenafil. So less side effects. Sildenafil increases the blood flow in the penis also and all over the body organs also. Heart, lung, kidney, everywhere. But tadalafil has a 75-80% target is penis and all that. And 25% all over. So it is less side effect as compared to sildenafil. So we normally give tadalafil rather than sildenafil.
Okay. And are there any natural foods that are available in the market which can replace Viagra? Which
Natural foods are like ashwagandha, then watermelon, onion is there, then banana is there, and so many is there in the market which it cannot replace, but it's helpful in getting that erection. But the blood flow increases there.
Okay.
Herbal medicines are there, honey goat weed, and all that is there. So they can increase the blood flow.
I see.
But allopathic medicine has a immediate effect. So they have a sustained effect and takes long time to get the erection and all that.
Okay.
So that is the beauty of allopathic drugs.
Now, in Wales, it's certainly said that from a young age, there are many young boys doing, especially during the puberty period, that they start masturbation on a quite high level. And in some male cases, it kind of prolongs till even the age of 30, 35, pre-marriage, post-marriage both. And they are so used to it that they don't kind of fancy having sexual relations with the opposite sex. So, what is the scenario over there? I mean, how can they overcome this?
See, masturbation per se is not bad. But doing excess of masturbation is bad. Doing morning, evening, daily, this is bad. Because if the person matures at adolescent age, his sex hormones also increase at that particular age of his. So he has naturally has a habit of doing masturbation once he gets the nightfall. He is habitual to doing masturbation. And I can tell you, this is a solo performance, masturbation solo performance. So doing masturbation is safer than going to sex workers. But because solo performance, no infection, nothing. You masturbate, ejaculate, matter ends. But if you are visiting sexual workers, CSW, then there is every chance of getting some infection, HIV, hepatitis, herpes, all that can happen. Even if you are using a condom, you are safe 99%, you are not safe 100%. With the body fluids exchange, some infection on the fingers and all that, it can transmit. And then it flares up. If you are not, now if you are there are some investigation there, pre-exposure prophylaxis, post-exposure prophylaxis, HIV and all that are there, VDRL, gonorrhea, all the investigation has to be done. So if the husband is there in Mumbai and wife is there for some work in Bangalore, what he can do? He has to masturbate every 10, 15 days, once in a month. He is safe because he is doing a solo practice. But if he is going to some sex worker, then he can land in the trouble. And that infection can be transmitted to the wife. So, per se masturbation is not bad, but excess is bad. So because you become habitual to that particular practice. But even if the male and female meets in the foreplay, we say that to get the erection, get the stimulus, get the excitement, get the orgasm, you masturbate, you do the oral sex, and then you perform. So it is a stimulus.
Anything in excess is bad for you.
Excess is bad.
Be it eating, be it drinking.
Anything, water drinking more is also bad. So what else?
True. Coming to one of the point about having multiple partners, it is the culture has actually come from the old ancient
times.
That a male or a female can have multiple partners at any given time. How safe is it, and does using contraceptives like condom and all will help? That was my one question. Second was basically they also kind of indulge into unnatural sex, as in instead of having normal intercourse into the vagina, they indulge into anal sex. Is it advisable? Is it bad for your health? What is the question over there? What is the answer over there?
एक कहावत है कि घर की मुर्गी दाल बराबर. So persons are exposed to so many attraction in the world. So they may end up having multiple partners. But there is risk involved in that. See, if the partner is female partner and if the person is going, she may be having some other 10 partners. Who knows? So there is every chance of getting infection. If one of the 10 partners is harboring some HIV virus, he does the sex with that one lady, she harbors that organism virus. And if you sleep with that, even if you are using the condom, 99% safe. But again,
1% chance.
1% chance of getting it. So multiple partners are definitely bad. We don't recommend to do multiple partners. It is at your own risk you can take the chance. Nobody will recommend to have multiple partners. What is there? People go, the shippies you said that they have a wives on every port. so it is like that.
And what about the point of unnatural sex? I mean, that is increasing rapidly in Indian culture right now.
If the male and partner both agree for the natural, unnatural sex, there is nothing bad. But if you are doing the sex with unknown person and if you are doing unnatural way, then there is because the anal canal harbors the HIV virus more than the vaginal secretions.
Oh.
Yeah. And this is unnatural sex happens in homosexuals more. Homosexuals. So they indulge in anal sex. They don't have vagina, so they have to do anal sex only.
Yeah.
And the chances of HIV is more in the homosexual than the heterosexual. There are 5 types: heterosexual, male to female; homosexual, male to male; lesbian, female to female; and asexual are they cannot enjoy sex with anybody, male or female. Both, if they enjoy the oral sex, anal sex, and all that natural sex, changing the positions, the person might enjoy the different positions. So they have to agree with each other and they can do the n number of things. Like every person has n number of arousal spots in the body of the male and female also. And if they have a different position, like anal sex, a different position, normal sex, a vaginal position, but they enjoy it. So why not?
At Dr. Vaidya's laboratory, we have come up with certain kind of sexual wellness packages for both male and women. Some of the tests that includes in the packages are your CBC is there, blood sugar testing, fasting and post. We have FSH, LH prolactin test, VDRL serum, testosterone total, hepatitis A, B, C, TSH, progesterone, AMH, and your HIV.
Correct.
So, are there any other tests that, as a pathology lab, we would like to, that you think that we should add into our packages?
As you said, the profiles like lipid profile, thyroid profile, LFT, these are very important. And blood groups also should be added because if she is negative and he is positive, then you have to take precaution. And most of the tests are covered in these packages.
Thank you for that input. That was actually quite enlightening for our audience and everyone over here.